I'm going to start out with the mundane, earwax. Something we all have to deal with one way or the other, either in ourselves or in our friends or family. I want you to know that uniformly we all agree that people should not use Q-tips. So just get that one right out there to start with. That's not a good way to remove earwax. This is the diagram you've seen before that Dr. Walls had shown about the ear canal. Because a couple of points I would just like to make. Earwax is produced by small glands in the outer part of the ear canal. And I want to stress in the outer part of the ear canal. Only in the outer third of the ear canal are these glands present, and they produce what's called cerumen or earwax. And that wax has a purpose. The purpose is to seal the ear canal skin from invading bacteria and viruses and fungus, and also protect it against moisture. And so it serves a good purpose when it's working well, but it's not produced deeply in the ear canal. It's only produced in this outer portion out here. Now sometimes that can build up, and also one of the things that I think is a joke that is played on all men is that we can't grow hair in our heads, but we can grow hair in our ears very well. And so I encourage men who have wives or who have good friends who can to trim the hairs around the outer part of the ear with a small pair of blunt scissors, and use those scissors only for that purpose. But they sell small blunt scissors which are helpful for that, and it helps to keep the ear canal more open so that the sound waves can reach the tympanic membrane or the eardrum. So we're left with the wax being present in the ear canal. How do we get rid of it? Normally it comes out on its own, and so those of you who have children or grandchildren may notice that occasionally there's like a little brown ring around the outer part of the ear, right at the ear canal, the meatus. And that is the way it's actually supposed to work. And if the mother or the grandparent or even the child, if they do, just take a damp washcloth with no soap on it and just wipe it around that part of the ear, they often can get that wax out, and it clears the ear canal, and it's not a problem. As we get older, the wax gets more solid and less liquid, and it tends to build up in the ear canal and then create some problems with blockage of the sound waves getting to the tympanic membrane. And that can be aggravated by wearing hearing aids, because when you put the hearing aid in, you run the risk of pushing it in deeper, and so that can be a problem. So what we recommend is for people who don't wear hearing aids to put like 5 drops of baby oil in the ear canal twice a week, or once a week, depending on how often they need to do that. If they've had a problem with wax buildup in the past. If they've not, they probably don't need to do that, because the amount of wax they're producing is probably a smaller amount, and it's more liquid, and it tends to come out normally. They really don't need to be adding anything to the ear canal. But if they have a problem with the building up, using 5 drops of baby oil or mineral oil in the ear and doing it twice a week is a good way to try to keep the wax off, to prevent it from building up as much. Now, even with that, some people still need to periodically have the ear wax removed. And that's something that should be done often by a primary physician. Otolaryngologists in my specialty can do that, but often in primary care offices, there'll be a PA, a physician's assistant, or a nurse's assistant, a nurse practitioner, or even the physician themselves in the primary office can remove the wax. But it's the outer third that is where the wax is produced. The other topic I want to talk to you briefly about has to do with vertigo. All of you, or many of you, know already that the inner ear has 2 functions. One is hearing, and one is balance. And we're talking mainly today about the portion of the inner ear which has to do with the hearing aspect. And but we do see people who have some problems with both. We also see people who just have a problem with their balance. And we go back to that. We try to differentiate initially about the problems with balance. Is it vertigo or is it dizziness? And vertigo, the word means basically a sense of motion when there isn't any. So if you turn your head and you stop, but you feel like things are continuing to move, that's vertigo. Now sometimes it's not so much things spinning, it could be just a feeling that there's some motion, what's called oscillopsia. And it's actually where you feel like you're on a ship, but you aren't. And where the ground underneath you seems to move, and that is also a type of vertigo, a little different type. And then, of course, that is not to be confused with dizziness, but it often is confused with dizziness, which as you can see here, has to do with the other aspects. It has to do with a sensation of motion in our head, rather than a true spinning sensation, or lightheadedness, or some nausea, or imbalance. And sometimes just not quite feeling right can be described as dizzy.